Hi there, thanks for joining me. I'm Rowena and I'm a cognitive hypnotherapist and inner child therapist based in London, UK. In this short video, I'm going to explain a bit about what an inner child is and how this kind of therapy can help resolve feelings of insecurity, low self-worth issues, feeling less than others, having difficulties connecting, anxious or avoidant attachment issues. Lots of people come to me having explored other types of therapy, but still feel stuck and are struggling to understand why. So let's take a look at where these issues come from and how inner child work and hypnotherapy can help. So, what is an inner child? Well, we can think of these inner child parts as internal representations of childhood experiences that still carry strong emotions inside us. These can be memories of times when you felt rejected or abandoned by a parent, shamed or made fun of, scorned or raged at, ignored or neglected, or any other type of emotional experience that left you feeling hurt by your caregivers. When you get triggered by a situation or emotional experience later in life, your nervous system reacts in the way that it did in those early life experiences. In those moments, you might not know this is what's happening, but it can feel like you've gone back to being a scared and vulnerable little child. Your reactions in those moments can look like shutting down or being unable to express your needs and emotions, spiraling into panic, overwhelm, or anxiousness, angry outbursts or fits of rage, an inability to control your emotions. Maybe you break down in tears when you need to assert yourself or ask for something that you need. You can have intense feelings of shame or rejection sensitivity that can come up in relationships or around colleagues at work or even in social settings. Or you might go into people pleasing, pretending that everything's okay when your boundaries have been crossed, or being needless and wantless to avoid conflict. You might be the overdoer or the overgiver, sacrificing your own needs to make people like you or want to stick around. You could have a tendency to mask your emotions, believing that it's not safe to be vulnerable, or afraid that if you show how you really feel, that people will leave you. This is a kind of shape-shifting to try and be what you think others want you to be. And it can leave you feeling like a fraud or like you don't even know who you really are. These imprints on your memory and nervous system are what we would call emotional injuries. And they're like emotional scars that are formed during childhood in those extremely painful experiences. They're usually the result of frequent or unrepaired emotional experiences that were overwhelming, confusing, or hurtful to you as a child. And they can be experiences of all kinds of behavior, such as physical or emotional abandonment or rejection, toxic rage, uncontrolled anger, or physical abuse towards the child or any other family member, shaming or scapegoating the child, making them feel like they are the problem, parents who were preoccupied with stress or worry, addictions or other mental health issues in the family, or parents who are just overwhelmed and unable to be present with you as a child. If you had parents who are particularly shaming, angry all the time, abusive or neglectful, you may have come to expect negative responses from them. You may have been afraid that you'd get punished for having an accident, or worried that if you have a need, you'll just be told to stop bothering them. If your parents were quite unpredictable or scary, you may have learned to withdraw or stay out of the way so that you didn't get in trouble. You may have developed a strategy of telling lies to avoid getting told off or getting a beating, Or you might have developed anxiety or panic disorders if your parents were extremely abusive or scary. These emotional scars also store painful beliefs that were formed in those moments. And these can be things like, I'm no good, or I'm bad, I don't matter, or I'm not wanted, or I'm all alone. It can be really painful when these core wounds get triggered. You can spiral into terrible feelings of shame, unworthiness, or panic, or even feeling like you're going to die in those moments when those child parts get triggered. And of course, all of this affects your attachment style and how you feel, behave, and communicate in relationships later in life. One strategy that you might have learned during childhood to cope with those kind of experiences is by taking on a family role. You might have been the helper or the hero child, believing that if you could just do more or help out, fix things, or take care of your parents, that everything would be okay. Or maybe you were the entertainer, the one who tried to make everyone laugh and distract them from being angry, or so that you get noticed. Children who are scapegoated often end up believing that they are bad, and they sometimes act out trying to express the family's pain in their own behaviour. Or you could have been the lost child, the one who fades into the background, feeling like your needs are a burden or that it's just not safe to be seen or heard. So, all of these experiences and strategies are what turn into wounded inner children. And these parts of you often feel fearful, insecure, needy, bad or defective, or have deep emotional pain at their core. They get activated later in life when you experience painful emotions such as rejection, during conflict, or when you've done something that you perceive as bad or wrong or shameful. Then there's the second type of inner child, which we call the adapted child. And these are the parts of you that learn strategies to cope with those painful experiences in childhood. And they often feel angry, defensive, or shameful, and can act out by being manipulative, naughty, or rebellious. These are the parts of you that are usually untrusting, closed off, dismissive, or can come across as good and perfect, but also hold a lot of resentment and have difficulty connecting with themselves or others. These parts of you get activated when you feel hurt, unsafe or vulnerable, attacked, shamed, let down, angry, disappointed, or if you have unexpressed needs. So here's what it can look like when these parts of you get triggered. Maybe you feel rejected or hurt by somebody that you love. And so your wounded inner child part gets activated, leaving you feeling like no one cares about you, or you're all alone and that you're unloved. Then an adapted child part that learned to push pain away with anger might react by attacking that wounded inner child. Maybe you've experienced this if you've felt hurt and found yourself feeling shameful and saying all sorts of horrible things to yourself, such as, what's wrong with me? Why am I so useless? Or no wonder nobody wants me. That could be that your inner child parts have been triggered and you're going into an adapted child response. Or sometimes another adapted part might take over, deciding that if I turn the anger onto other people, then no one can hurt me. And so you might lash out in rage and say horrible, hurtful things to someone that you love. Then there's the teenage part, also known as the adapted adult child, which often responds when triggered with this kind of screw you attitude. When this part gets activated, you might resonate with feeling like you hate everybody, thinking things like, I don't need you anyway. Or you might indulge in destructive or addictive behaviors when this part gets activated in an attempt to numb out pain or get a need met. Or maybe you have a core wound of being unwanted or unlovable that gets triggered, and your adapted child goes into people pleasing. When this happens, you can feel extremely anxious and spend all of your time thinking about how to keep the other person happy or make them want to stick around. If you have the good and perfect adapted teenager, you might completely abandon your own needs and boundaries, accepting poor behaviour and ignoring red flags just so that you don't have to be alone or face conflict. So, how do we heal these emotional wounds so that they don't trigger us so much? Well, this is how I help people using inner child hypnotherapy. One of the things that we need to develop is a sense of a nurturing and loving inner parent. One of the problems when we get triggered into our child parts is that we lose connection with our adult self. The inner child can feel like they're all alone, out of control, or unable to cope. Let's face it, in those moments when your child parts get triggered, it's like there's no room for the adult to stay on board. And this means that the child parts of you often don't even believe that you have an adult in there. Some child parts think that you've been faking it at adulthood all along, and that one more rejection or knock to your confidence could expose you or just bring the whole house of cards crashing down. So, by creating a sense of an inner parent that can support the inner children that are struggling with these feelings, these parts of you can start to feel safer inside. We can't change the past or how you were treated by your own parents, but what we can change is how we treat and speak to ourselves. By developing a stronger, more loving inner parent, we can start to reparent and esteem these child parts inside us in the ways that they didn't receive in childhood. This results in a healthier inner voice that responds to painful thoughts and experiences in the way that a loving parent would, by encouraging, soothing, and affirming that child. With enough healing work, we can begin to see ourselves and the world differently. We become more comfortable with who we are, feel safer inside ourselves, and that we can meet our own needs. We have better boundaries and develop deeper and healthier connections in our relationships. And we have a kinder, more loving self-talk when things go wrong. We do this in therapy by using guided visualization to connect with and explore the emotions of those inner child parts, developing a therapeutic relationship that helps model healthy attachment, communicating with inner child parts regularly, both inside and outside of the therapy room, learning to identify their needs and how they show up in your life and in your body, meeting internal unmet needs and helping your nervous system learn to regulate through difficult emotions so that you can feel safe and more resilient inside. Rewiring and updating old beliefs and behaviors that no longer serve you, helping your child parts to see that they are safe with you now in the present and no longer trapped in the past. So if any of this resonates with you, or if you'd like to explore how we could work together, you can book a free 30-minute call with me where we can discuss your needs and see if we're a good fit to work together. You can also find lots of information on my website about my session fees, packages, and all the different issues that I help people with. I hope you found this short intro to inner child work helpful, and I look forward to connecting with you soon.